Welcome to the Wednesday edition of the MD Edge Daily News. I'm MD Edge editor Mary Ellen Schneider.
And I'm MD Edge editor Terry Rudd. Today, rosacea's global reach may be greater than expected.
Also today, how an MRI at prostate cancer diagnosis shapes disease management.
And later, new guidelines debut for mild traumatic brain injury in children.
But we begin today with an advance in preventing falls. A Tai Chi exercise program was more effective than multimodal exercise or stretching at reducing falls among older adults. That's according to findings from a 6-month study of 670 participants aged 70 and older. In a study published in JAMA Internal Medicine, the researchers randomized participants to a tailored Tai Chi program, multimodal exercise, or a control intervention of basic stretching. Each intervention consisted of a twice-weekly 60-minute session for 24 weeks. All participants had fallen within the past year or had impaired mobility that put them at increased risk of falls. Overall, the Tai Chi group had a 58% reduced incidence of falls compared with stretching and a 31% reduced risk compared with multimodal exercise. The study authors say the Tai Chi intervention represents a promising approach to low-cost and easily implementable fall prevention programs.
The global incidence of rosacea among adults is approximately 5%. That's based on data from a meta-analysis and systemic review. It's a number that had been unknown, according to Dr. Lise Gether of the University of Copenhagen, Denmark. So, she and her colleagues analyzed 32 studies, including more than 26 million patients. Overall, the pooled proportion of individuals with rosacea was 5% in the general population and 2% among dermatology patients. The percentages varied depending on who was doing the diagnosis. The self-diagnosis rate was nearly 10%, while the physician diagnosis rate was 5.5%. Rosacea prevalence by age was highest among people aged 45 to 60 years. Estimated rosacea prevalence by gender was similar, 5.4% for women and 3.9% for men. The findings appear in the British Journal of Dermatology.
Men who undergo an MRI of the prostate when they're diagnosed with low-risk prostate cancer are nearly twice as likely to be managed with active surveillance compared with men who don't get an MRI. And for men with low-risk disease, that MRI can boost their confidence in deciding to choose active surveillance over immediate surgery or radiation therapy. That's according to Dr. Michael Liepman and his colleagues from Yale University in New Haven, Connecticut. Dr. Liepman says active surveillance is increasingly accepted as an initial management strategy for patients with low-risk, localized prostate cancer. Yet the majority of patients with low-risk disease still receive definitive treatment. That's in part because fear about possibly underestimating a patient's risk of harboring aggressive disease remains a strong motivator to treat. So the study investigators reviewed records from the SEER Medicare database, looking specifically at the association between MRI and patient management. They found that the use of MRI in patients with low-risk cancer increased from 3.4% in 2010 to 10.5% in 2013. MRI was performed significantly more frequently among patients who were managed with observation, compared with patients who underwent treatment within a year of diagnosis. Dr. Liepman and his colleagues found that patients who underwent MRI around the time of their diagnosis were 1.9 times more likely to undergo active surveillance.
And finally today, doctors can safely skip imaging for most children with mild traumatic brain injury, and they should base management and prognostication on clinical decision-making tools and symptom rating scales. Those are instructions from new practice guidelines issued by a working group at the Centers for Disease Control and Prevention. The guidelines cover 19 main topics, sorted into guidance regarding the diagnosis, prognosis, and management and treatment of mild TBI in kids. The diagnosis recommendations focus on determining which children are at risk for significant intracranial injury. Doctors usually shouldn't obtain a head CT, nor should they order an MRI for initial evaluation. Skull radiographs shouldn't be ordered in the absence of clinical suspicion for skull fracture. Instead, consider these risk factors for intracranial injury: age younger than 2 years, any vomiting, loss of consciousness, or amnesia, a severe mechanism of injury, severe or worsening headache, or non-frontal scalp hematoma, a Glasgow Coma Scale score of less than 15, and clinical suspicion for skull fracture. The new guidelines appear in the journal JAMA Pediatrics. To view the complete recommendations, follow the link in the podcast description. And that's the MD Edge Daily News for Wednesday, September 12th. Look for us on Spotify, Amazon Alexa, Google Podcasts, and Apple Podcasts. For MD Edge, I'm Terry Rudd.
And I'm Mary Ellen Schneider. Remember, if you like what you're hearing, rate us on your podcast app. Thanks for listening.